I go in, and when I was under, the whole entire staff froze because they saw it was cancer. He had no idea that's what it was going to be. They had to dismiss themselves from the operating room for a minute and collect themselves. And I didn't know anything because I'm on the surgical table. So afterwards, he wakes me up and he goes, I've got something to tell you. My name's Shawn. I was diagnosed with testicular cancer after reading Lance Armstrong's book a week later. So when I found out, had non-seminoma and seminoma. So I had both forms of testicular cancer, which was really interesting. And it was found during a routine surgery. And the thing, I was a personal trainer at the time, and I used a lot of that knowledge on mindset to really work through my own way of dealing with chemotherapy and cancer and how things were. And so now I'm a high performance coach that works with entrepreneurs, CEOs, professional athletes, and I'm also a medical hypnotherapist. When you exercise, a lot of times there's a thing called a varicose or a hydrocele where maybe you had some impact to the testicle area from working out. So the doctor's like, oh, you're fine. It's probably something you did. We'll do a routine surgery. He did an ultrasound. He's like, okay, you have a varicose, which means there's not as much blood flow to one side. And then the hydrocele is like water goes in, but the fluid doesn't come out. So we just make a slit. We release it. I'm like, okay. He goes, don't worry about it. It'll be fine. Then it started getting larger. I'm like, yo, man, what is this all about? He goes, okay, let's just take care of this when you have time. And in the gym business, Christmas time is a little slow. So I had it set up for a routine surgery. They were going to do the hydrocele and the varicose together. He goes 30, 40 minutes. So I go in, and when I was under, the whole entire staff froze because they saw it was cancer. He had no idea that's what it was going to be. They had to dismiss themselves from the operating room for a minute and collect themselves. And I didn't know anything because I'm on the surgical table. So afterwards, he wakes me up and he goes, I've got something to tell you. Like, okay, what? And he told me the diagnosis. And again, you're groggy. And I'm like, okay. And I said to the words of blank happens. What do we do now? And he goes, did you hear what I said? I'm like, yeah, but I can't do anything about this. What do we do moving forward? And he's like, wow, most people don't react this way. I'm like, what do you want me to do about it? You took care of what you could take care of, right? He's like, yeah. I said, you did your job. Great. Now let's go. And that's how I've always been. Because I can sit there and be like, oh my God, why? We need to take a course of action. It's time to go. And at that point, they didn't realize what stage it was. I had surgery, so an orchiectomy. So I'm a little in pain. We did research to figure out who is the best person to tackle this, because I know one place in Texas and Indiana, two of the highest ranking places for this. Now, at UNC Hospital, the doctor had an attitude about this. And the thing that's different with me is my clients were a lot of doctors. So the head of UNC Hospital and their medical school was a client of mine. The head of urology was a client of mine. The head of cancer at UNC was a client of mine. I said, I'm going here to this well-renowned doctor, and I'll bring back the protocol. And the doctor that they had me set up with, who I had no idea who it was, got really upset with me. And I'm like, listen, I'm already under stress. Why do I need this? So she actually got fired. And then I went up to Indiana, met with Larry Einhorn. He goes, I'm actually going to probably almost put you near death because the treatment is really severe. I'm like, okay. So they created the protocol. They sent me home. A week later, I started chemotherapy. The interesting thing, I get to UNC Hospital, and because it's a state hospital, you go in and you're like, okay, how long is this treatment going to take? And they're like, well, if we ran you at 165, I guess, drips per whatever milliliter, I don't know all that stuff. They're like, you're going to be here for like 16, 18 hours. I said, okay, so we're going to jump you up to 650. I'm like, 650, is that normal? Like, well, you'll get out of here in 6 to 8 hours. And so I would go to work and then come in for infusion. The infusion, people don't realize, it was 5 days in a row for 8 hours. So pretty much it's one of the highest runs of drugs into your system to combat this cancer. So for the first month, I could go to work. And then they're like, listen, you got to come in early because we can't stay here all night with you. So I was outpatient. I lived down the street. So I would come in early. And the thing is, being at the state hospital, they had people, this just blows my mind, from prison in a corner, strapped to the table with cuffs. I'm going, what do you think they're going to do? Run? Like, come on, man. We're here for treatment. And people would ask me all the time, why do you have so many doctors? I'm like, they're my clients. So all the people from the hospital would come in and show up, and they're like, wow, you don't look like you have cancer. I'm like, what does a cancer patient look like? They're like, well, how'd you get it? I'm like, I don't know. I didn't order it on eBay or Amazon. So, it's just, it is what it is. And the treatment lasted for 4 months. I lost 45 pounds during that time. The weirdest thing about that whole thing is you don't realize how it accumulates. So my hair all fell out. This isn't from chemo. So I knew what my head looked like. So when it started thinning, I shaved it off. And I went for a walk one day and no one was home. And I'm like, whew. I'm like, I got to turn around. I didn't think I was going to make it home because it affected my lung capacity so much. And I think that's the thing is you're all right one day and the next day you're like, ooh, I need time to relax. And being younger, I was 31 or 32 at the time. When people would come over, it was almost like they felt they were going to catch it. They didn't know how to react or talk to me. And I remember all the guys and some girls from the gym came over and I'm sitting there and they're all sitting around like, this is awkward as heck. Like, what am I supposed to say? And they're all trying to ask weird questions. So I'm talking. And at one point, they're like, okay, cool. And they all leave. And I just went and got sick in the bathroom because of the stress of trying to look normal and feel normal. And there are certain days like they'd get you a drug to produce more red blood cells because your count, or white blood cells because your counts are down. And that was 10 times worse than the chemotherapy drugs because of how achy it made you feel. And the funny thing was, this kid I was working with, he was 10 years old and he was going through cancer treatment at the time. I'm like, wait a minute, why does he get to take THC, or they called it Marinol at the time? And I don't have that. Like, sorry, you don't get it. I'm like, nowadays they would have used that for anti-nausea. I'm like, why was like your food wasn't important, what you ate, as long as you ate. Don't take supplements because they're going to screw up your blood work. I was just blown away by all the things they told me not to do. There were very few, hey, eating no sugar will help you out, or getting this or doing this would benefit you. There was none of that back then, which I'm glad they've completely taken a different approach to treatments. At first, it was weird. You get really tired and it hit you all of a sudden. Like after treatment, I'm not doing anything. About 24 hours later, I was fine because I took a lot of different supplements to get the drugs out of my system so my immune system would build itself up, because again, those drugs only last a certain amount of time. You want to get them out. Drinking a lot of water was helpful. Taking different supplements were helpful for flushing it out of my system because it does put a lot of stress on your kidneys and liver. So the weird thing, because I didn't do a port, I don't know why I didn't do a port. They had it in my arm and they would just tape it up every week and they'd switch arms. I got my veins started to harden in my arm and it hurt so bad. I had no idea what the heck that was. And basically, like, I don't have a bicep vein because it just flattened out and disappeared. And the weird thing was when they would try to get my veins would move. I'm like, what? They're like, yeah, we go near you with a needle and your vein moves to get out of the way. It didn't want to, be stuck after a certain amount of time. Another effect was I couldn't sleep. It would be throughout the day, nighttime. It was weird. Um, I would, it's funny, I had a table in front of me and I would have different waters and juices and temperatures because sometimes I'd drink it and it would taste all funky weird. And then the temperature would be different. My taste buds changed drastically through the entire time. Skin almost got a gray look to it. And I smelled like chemicals, which was weird. You get that weird chemical smell. Um, And once in a while, I would get nausea, but they gave me these anti-nausea pills, which actually knocked me out. So I didn't care for them too much. I didn't take any pain meds either. And just I'm against as many drugs as I didn't need to take. I wouldn't take. I did a lot of visualization work where you visualize. I picked Pac-Man that would go in and gobble up the cancer, and then when I'd go to the bathroom, I would get rid of it. I did a lot of work motivating athletes. The most interesting thing was I was out at a place getting lunch, and this woman walks up to me and she goes, "Hey, I haven't seen you in a while. What's been going on?" I go, "Yeah, I'm going through cancer." She goes, "When you're done, I want to train with you." I'm like, okay. So the motivation that to get back to helping people was amazing. This person, after we trained, she lost like 30 pounds, went on to win a gold medal in the Olympics in women's soccer. And she was like one of their outstanding players. And that was the motivation that I had, that people still needed what I did. When I was in chemotherapy, I would be listening to different things, and people were like, "Well, what are you listening to?" And there would be motivational things off of YouTube, certain sayings I would use. And again, remember, there's points where you're just like, "Why me?" And you just have to fall apart emotionally and let that out. I remember asking my dad to shave my head. He goes, "Why do you want me to do it?" He's and the interesting part is because I felt connected to him to do this. And I was married at the time, soon after got divorced because my wife then couldn't deal with it. She would just go do her own thing. And she would talk to me like nothing was happening or going on. Like, oh, and she'd just sit there. My mom was always there, and which was comforting to have someone there. And that's the thing is the ex, being my wife at the time, would go out of town to do her training, and I'd have a buddy stay with me. Because I'm like, dude, I need someone to sit here because you can't be by yourself because all kinds of crazy thoughts go through your head because you're not sleeping normal. We had animals, so I need help, someone to help me take them out. And again, it's always, what did I do to deserve this? And then you realize, like, okay, what is the thing, the reason behind why cancer shows up? And this is what I explain to people that I work with who've gone through cancer. Cancer is you. It's not something outside of you. So if your body created it, that means there's an imbalance. And the imbalance can come from internal stress. It can come from external factors too, like chemicals and all kinds of other things. If you can create it, you can get rid of it. And people are like, well, that's crazy. I'm like, no, it doesn't have a mind of its own. You have a say in how you boost your immune system with the hormones that are in it by how you feel and look at the situation. This is based on science. This is not just something that, oh, this is woo woo. No, quantum physics, energy. The more positive you are, you think about it, the more you surround yourself with positive things, the better food you take in. It gives you an advantage over just not caring. 4 months later, they took a blood test. They're like, you have no more markers. We did a CT scan. There's no more cancer there. Your lymph nodes, like they said, were completely clear. You're good to go. And I'm like, what does that mean? Because what is remission? That means it's not active to me. Is it there though? We don't know. And then I'm like, okay, what's the follow up? And I think it was every month in the beginning, then it was every 3 months, and every 6 months, and once a year for 5 years. I'll tell you what, man, that first time going back is scary as hell because you don't know. It was the most freaky, uncomfortable place I've ever been in my life because I didn't want to be back there. And you don't know when you're going through this, is it going to come back? They don't they don't know. And people, get out of remission all the time. Why? No one knows. I mean, we may have some thoughts on that, but It's a scary thing, man. Then you go back 3 months, then you're fine. Then the 1 year is a scary one because you get the 5 years, you're like, oh, you're free. I'm like, what does that mean? And then what did the drugs do later on to cause other issues? And the reason I'm bringing that up, I've had a heart attack 3 years ago. Yeah, I eat clean. I exercise all the time. I'm like, they're like, it could have been a cause of it. We don't know. But there's no family history. You had the widowmaker was 99% blocked. I just went to the hospital feeling, okay, this has happened. Had a knee blowout in a race, had to have a hip replaced, and then most recently with pulmonary embolisms. And there's no history of any of this. And what does a drug do short term? It saves your life. Okay, what does it do long term? No one knows. So again, you just hope for the best and lead as healthy a life as possible. I've just watched too many people wait too long to go to incorporate certain modalities into their treatment because they're exceptionally desperate. Like they were like, okay, I'm going to do this treatment schedule. I'm like, great. What about these other things? Oh no, this person said don't do that, and they're afraid of what their family's going to say if they do something, I'll quote, alternative. And that's why I got into the mindset piece, because we're all have the same amount of time. We all have the same resource. It's why is one person or a group of people doing something and another isn't. But when you have the treatment stop, the quote conventional treatments aren't working. You've been denied all the testing or what are those called when it's like a group of tests they're going to do, but they're not conventional. Clinical trial, and what level are you at? And then people just have so much hope for a test or a clinical trial that that's what's going to save me. No, you're going to save you. That may help, but if you believe something so much, you can actually manifest it. We've all been put here for a purpose. And if you don't know what your purpose is, go find it now, because you do not know how long you have. People all have this notion that they're going to grow up and enjoy life and play sports and maybe get married, maybe have a family, grow old, retire, and enjoy their golden years. Sorry, that's a fairy tale. There's a ton of stuff that happens in between there. There's a ton of amazing things. There's a ton of things that are going to scare the hell out of you, that are going to be disappointing. There's going to be death. There's going to be pain. There's going to be injury, both mental, physical. Live in the present moment. Don't wait to have the conversation that's important. Don't wait to call up that best friend or that loved one and say, hey, just want to know how you're doing. We should get together. Because one day you're going to get a call like, oh, that person's not around, or they went through this thing. And people then, if you've seen it all the time, get diagnosed with cancer, and they do these amazing things in life. Like, why weren't you doing that beforehand? You don't need to go through a struggle to have a story. Just serve people at your highest level and learn as much as you possibly can about the things you're interested in, and never stop being a better version of yourself. We're never going to be perfect, but that's not life. It's about enjoying the things you screwed up and sharing those so someone else doesn't make those mistakes. Because there's no right or wrong way of doing it. It's just your way.